growing a child, right? So the growth occurs in the back. Growth doesn't occur in the front of the mouth, it occurs in the back of the mouth. So when you use an RGGA appliance, you're able to actually blossom the child's natural form and get their jaws developed in the way that the body intended them to be. The appliances that we use are simply, they're simulating the tongue's effect, because the tongue is our growth appliance for the most part in our upper jaw, along with nasal breathing, because nasal breathing actually has an impact on blossoming the nasal passages, which is also the roof of the mouth. So when a patient nasal breathes and swallows properly and keeps their tongue in the roof of the mouth, all the body is getting the triggers to properly develop in their upper jaw. On top of that, if the lower jaw is functioning properly and the patient's swallowing properly and they don't have a tongue tie, the lower jaw will continue to keep pace with the development of the upper jaw. It's changes to those breathing patterns, the lip patterns, the swallowing patterns, the tongue. Those changes are the soft tissue changes that directly impact the blueprint the bone is following in order to grow. So we always want to go back to those three things and make sure that they're properly developing well. But we see it day in and day out from every age range. We just want to get back to essentially trying to mimic what the body should have already done, get it back on track, get the growth back that we are needing out of a child, and make sure that we've caught back up to what their genetics would have wanted in the first place. And then secondly, made sure the habits are there to instinctively make sure that they live that way and sustain that change for the rest of their life. You know, for a lot